Reye's syndrome is a rare but serious condition that causes swelling in the liver and brain. It most often affects children and teenagers recovering from a viral infection, like the flu or chickenpox. While the exact cause remains elusive, it's strongly linked to the use of aspirin during these illnesses. This can cause irreversible damage, therefore early detection and treatment are extremely important. The exact etiology of Reye's syndrome is not fully understood, but a strong association exists between the condition and the use of aspirin or other salicylates to treat viral illnesses, particularly influenza and chickenpox. It's believed that a combination of factors, including a pre-existing viral infection, an underlying genetic predisposition, and exposure to salicylates, contribute to the development of the disease. It's important to note that not every child who takes aspirin during a viral illness will develop Reye's syndrome, indicating other factors are involved. At a cellular level, Reye's syndrome disrupts the normal function of mitochondria, the energy-producing powerhouses of our cells. This mitochondrial dysfunction primarily affects the liver, leading to the accumulation of fat, which is called microvesicular steatosis, and to elevated levels of ammonia in the blood, called hyperammonemia. The brain is also significantly impacted by cellular edema, leading to increased intracranial pressure. The combination of liver failure and cerebral edema causes the severe symptoms associated with Reye's syndrome. Reye's syndrome is rare, primarily affecting children and adolescents between the ages of 4 and 14. The incidence of Reye's syndrome has significantly declined since the mid-1980s, primarily due to increased awareness of the link between aspirin use and the condition. Widespread public health campaigns recommending against the use of aspirin in children and teenagers with viral illnesses have proved to be effective in curbing its prevalence. The symptoms of Reye's syndrome can appear suddenly, typically following a viral illness such as the flu or chickenpox. The initial symptoms often include persistent nausea and vomiting, lethargy, and behavioral changes like irritability or aggressiveness. As the condition progresses, more severe symptoms may develop, including seizures, confusion, disorientation, loss of consciousness, and even coma. The rapid progression of these symptoms necessitates prompt medical attention. Diagnosing Reye's syndrome requires a combination of clinical evaluation, blood tests, and sometimes a liver biopsy. Blood tests can reveal elevated levels of liver enzymes, indicating liver damage, and high ammonia levels, which are toxic to the brain. A liver biopsy may be performed to confirm the presence of microvesicular steatosis, which is characteristic of Reye's syndrome. It is also important to exclude other conditions that may mimic Reye's syndrome, such as encephalitis, meningitis, and metabolic disorders. Reye's syndrome is classified into stages based on the severity of the symptoms. The stages range from 0 to stage 5, with stage 0 representing mild symptoms and stage 5 representing coma and respiratory failure. The staging system helps doctors assess the severity of the condition and guide treatment decisions. Treatment for Reye's syndrome focuses on managing the symptoms and preventing further damage to the liver and brain. This typically involves hospitalization, often in an intensive care unit, where vital signs can be closely monitored. Medications are used to reduce intracranial pressure, control seizures, and correct metabolic imbalances. In severe cases, mechanical ventilation may be necessary to support breathing. Early and aggressive treatment is crucial to improving the chances of recovery. The most effective way to prevent Reye's syndrome is to avoid giving aspirin or other salicylate containing medications to children and teenagers, especially when they have a viral illness. Read the labels of over-the-counter medications carefully to ensure they do not contain salicylates. If a child has a fever or pain, consider using acetaminophen or ibuprofen instead of aspirin, unless otherwise directed by a healthcare provider. Vigilance is key to prevention. The prognosis for Reye's syndrome varies depending on the severity of the condition and how quickly treatment is initiated. Early diagnosis and prompt treatment can significantly improve the chances of recovery. However, even with the best medical care, some patients may experience long-term neurological complications, such as intellectual disabilities or seizures. Recent research is focused on understanding the genetic factors that may predispose individuals to Reye's syndrome, as well as developing more effective treatments for mitochondrial dysfunction and cerebral edema.